looking at the muscles that move the thigh, basically the muscle that move the femur. First off, we'll look at a muscle. It's actually a pairing of two muscles, but it's the iliopsoas. So we have this muscle and this muscle. We have the psoas major and the iliacus muscle. Together, these two are going to make the iliopsoas muscle. The iliopsoas grouping, so the iliacus and the psoas major, are going to cause flexing of the thigh. It also helps with flexing the trunk as you're bowing at the waist. So flexion of the thigh, the iliopsoas group. So here is the iliopsoas group. Iliacus, psoas major. Continuing on with a different view now to show more muscles that move the thigh and the femur, looking for pectineus. Now pectineus is a little bit deeper in this model, but you can see a little bit of it is located just right here under these vessels. To switch views from the model to a diagram for the pectineus muscle, we can see that the pectineus muscle is located right here. So we have our pectineus muscle shown on a diagram just to give a little extra view compared to a model. Now, pectineus is going to adduct, adduct, flex, and it can also medially rotate the thigh. So pectineus is adducting, flexing, and medially rotating the thigh. Changing models here, we're looking now at a slightly different leg model because it's going to include part of the coxal bone. So now what we're looking at in this model is going to be the gluteus maximus muscle to start with. This muscle right here, this superficial muscle, is going to be the gluteus maximus muscle. Now the origin of the gluteus maximus can come from the dorsal ilium. It can originate from the sacrum. It can also originate from the coccyx. So all of that origin is up here on the posterior aspect. So this would be posterior. It's then going to come and insert into the more lateral aspect. This is the lateral part of the leg right here. The insertion is going to be the gluteal tuberosity as well as the iliotibial tract. So gluteal tuberosity and iliotibial tract. Its action is a thigh extensor. And the innervation is the inferior gluteal nerve. Now if we go just a little bit deeper, you can notice that just this piece right here, which is running under the gluteus maximus, so if we take that off, we can notice that this muscle right here is the gluteus medius. Now the gluteus medius is going to have origins from in between the anterior and posterior gluteal lines. But then you can see how it comes down and it inserts right here. The insertion is going to be the greater trochanter of the femur. To be precise, the lateral aspect of the greater trochanter. Now the action is abducting, so abducting, as well as medial rotation of the thigh. So abduction and medial rotation of the thigh. The innervation, the superior gluteal nerve. Now going down to the gluteus minimus, it's actually deep below here. So we're going to have to change views and look at a different aspect here. So if we move and bring this model in, it's in the same orientation. What you're seeing now, this is the gluteus medius, but it's been cut through right here. That cut is allowing you to see the gluteus minimus. So you can now see the gluteus minimus. So the origin of the gluteus minimus is going to be between the anterior and inferior gluteal lines. So again, between the anterior and inferior gluteal lines. Its insertion, the greater trochanter again. Now its action is the same as the gluteus medius was. It's abducting, so abduction, as well as medial rotation of the thigh. And the innervation is the superior gluteal nerve. It's the superior gluteal nerve. Again, switching models, this one shows a nice view of the next muscle, the tensor fasciae latae. Now you can see that this muscle actually is going to go into this long connective tissue here, which is your iliotibial tract or your IT band. Now the action of the tensor fasciae latae is going to help to stabilize or steady the knee. And that's occurring because you have this long connective tissue running all the way down past the knee. So your tensor fasciae latae. Switching back to the model that has the coxal bone in place, we're going to look at our next muscle, which is going to be piriformis. So now for orientation purposes, this is going to be lateral. This is going to be part of the sacrum coming down here. This portion of the leg is on the posterior side. This muscle right here is gluteus medius. We're looking at piriformis right here. So this small and very deep muscle is piriformis. Now piriformis is going to have the action of rotating the extended thigh laterally. So it's going to help with rotating the thigh during extension to a lateral turn. So piriformis. Looking at this medial aspect of the leg, so right now this is the medial aspect, this is anterior, and down below would be the posterior aspect. We're looking at the adductor grouping. First off is the adductor longus. This muscle right here is adductor longus. Now, adductor longus is going to originate from the pubis, right near the pubic symphysis. So it's originating from the pubis, up here. It's going to go down and insert into the linea aspera. Its action is adducting, so adducting, just like the name, adducting. It flexes, and it can medially rotate the thigh. The innervation is the obturator nerve. The next one in the grouping is the adductor brevis, which you really can't see in the model because it's deep in here. Switching into a diagram view, we can now see the adductor brevis right here. For orientation, this muscle is the adductor longus. Here's our adductor brevis. Now the adductor brevis is going to have an origin of the inferior pubic ramus and the body of the pubic ramus. It's going to insert into the linea aspera. Action: the adductor brevis, like the name says, is adducting. It can flex and medially rotate the thigh. And like the adductor longus, it also has innervation from the obturator nerve. So we have the adductor brevis right here. Now the last muscle in this adductor grouping is the adductor magnus. Adductor magnus is going to be seen right down here. This one, a little bit more on the posterior aspect, but still lateral, is adductor magnus. The origin of adductor magnus is the ischial as well as the pubic rami and the ischial tuberosity. So the ischial and pubic rami and the ischial tuberosity. The insertion is the linea aspera, And then you have the action, adduct, just like the name again, adduct, but can also medially rotate and flex the thigh. The innervation, obturator nerve, but also comes off of partially the sciatic nerve. So obturator and sciatic nerves.